Paul Sweeney.
Thank you, Presiding Officer. To ask the First Minister what urgent steps have been taken to address reports of a mental health crisis with an increase in calls to the NHS 24 mental health hub.
First Minister.
There's no question that for many people recent times have been extremely challenging, exacerbated of course by COVID, and we know the cost of living crisis. So we are committed to support people's mental health and well-being, just as we are to support their physical health too. Our recently published Mental Health and Wellbeing Strategy, Delivery Plan and Workforce Action Plan recognises that an effective mental health system must address all levels of need. They set out what people have a right to expect from high-quality mental health services and the actions we're taking to achieve those aims. These actions will continue to evolve, of course, over time, and I'm always open to constructive dialogue with opposition parties on where they think we can go further. The member references NHS 24 call volumes. It's good that more people feel able to come forward and ask for help for their mental health, and our substantially increased investment in NHS 24 is helping to ensure that more calls can be responded to.
Paul Sweeney.
Data from NHS 24 reveals that calls regarding alcohol problems have risen by over 600 in 2 years, and calls regarding psychotic symptoms have more than doubled since 2021. That is not simply people presenting for the first time, First Minister. That's people who are not being seen urgently in the way that they should. And last year, astonishingly, over 7,000 children and young people were turned away from CAMHS. That is an average of 26 children a day. Primary and community care services are under growing pressure, and yet ministers have failed to start recruiting the promised additional 1,000 mental health roles, whilst cutting the budget for the coming year by £5 million after inflation. Will the First Minister accept that his mental health strategy will fail unless it is properly resourced?
First Minister.
When it comes to mental health funding, this government has a record that we are proud of standing on. And again, this is in the face of the most difficult set of finances and constrictions that we have faced in the history of devolution. The autumn statement from the UK government was the worst case scenario for Scotland. But despite that, difficult decisions, of course, have to be made across government in terms of budget. But this has not stopped our focus on key priorities. And since 2020-2021, the Mental Health Directorate's programme budget has more than doubled. When it comes to staffing, which is mentioned by Paul Sweeney, after following our record-breaking investment in CAMHS, which I've just mentioned, CAMHS staffing has more than doubled under this government. It's gone up by over 126% since 2007. And these are difficult decisions that are being made right across the United Kingdom because of those cuts coming from the UK government. In fact, if I look at Labour-run Wales and their 24-25 budget, here's a quote from their budget. We can no longer increase funding by 15% in 24-25 as was originally planned. We've reduced existing mental health budget by a further £6 million. So my point is, of course, that we will do everything we possibly can to increase the investment in mental health, but we cannot do that in the face of continued cuts from the UK government.